Of the coronavirus.
The virus breakout in Wuhan, China has created a global panic since the beginning of the year 2020. To sum up, COVID-19 stands for Coronavirus Disease 2019, is a member of the coronavirus family, the same family as the SARS coronavirus. It is a virus that is shaped like a crown, and it was believed that the source of the virus is commenced from bats, then spread onto other animals before contaminating humans. Differentiating from SARS, COVID-19 has infected a total of 65,247 people since January 2020 in the range of 28 countries, and the number keeps rising furiously ever since. There is a 14 days incubation period while infected with the coronavirus, and people of all ages may be infected. But those who can be infected are adults between the ages of 30 to 60, and those who can die are the elderly over 60. China produces a large number of masks because the masks are used by both infected and non-infected people. Most masks are disposable, and it is advisable to throw away after using them for 4 hours. But sadly, some used masks were sterilized and resold in China due to the lack of masks. Mask shortages are also occurring in Malaysia, and there is a fact that masks are selling at a high price compared to normal prices at this time. If immunity increases, the virus can be avoided. The shortage of masks is a serious problem faced all around the world. However, there are people who do not wear face masks in Malaysia. Minister Saifuddin has discussed the sufficiency for face mask supply and set the control of its pricing with suppliers and importers. 90% of surgical and industrial masks had supplied for limited use prior to the outbreak, and that the rise of unused also occurred during haze. People now think more about how masks are important, but people should also take care of their personal hygiene and sanitize their hands because coronavirus is infected by mucous membrane. The cabinet through the Minister of Home Affairs offered a leeway for mask manufacturers to put in foreign workers to work round the clock to produce face masks due to the increasing demand, especially for health professionals.
Hi, so what is your name?
Aisha.
Okay, and how long have you been working here as a pharmacist?
Almost 1 year.
Almost 1 year. What course did you study in university?
Pharmaceutical.
Okay. So before the corona outbreak, how many masks were stocked?
Before the outbreak, we usually receive about, I think previously it's more than 30 boxes in our store.
And did the mask shortage also occur when the haze happened last year?
Definitely.
Does the store manage to sell all the masks or keep some for the employees?
When the stock arrived, it finished on the same day. Yeah. So basically, we didn't manage to sell or keep some to our companies.
When the outbreak happened, people started panicking and rushing to the store to buy masks. Were you at the store when that happened?
Yes.
Did you have any opinions or any factors on why the mask shortage in Malaysia happens, and by far did you think of any solution for this issue?
About this, there come in several factors about this, and one of the reason I heard is that since the main manufacturer of this mask is from China, and because of the outbreak, most of the big company they have to shut down. So that's why it's become shortage to our country. Not because of that. Another reason is because many pharmacies or hospitals they also order from the suppliers, and since this is a sudden outbreak, so that's why it's become like this.
Are you aware that there are several people that see this phenomena as a profitable chance and bought the mask to resell it for a higher price, and what's your opinion towards it?
Yes, if there comes to this situation, of course there will be people out there taking advantage of this situation. But as someone in the medical field, I think this is really not appropriate to take advantage of this situation. Yeah.
If so, does your store manage to do something to solve or prevent this from happening?
From now, we just rely on our warehouse, and it depends on the warehouse. If they have stock, so we order from them. If they're not, there's nothing we can do about it.
We were informed that the mask shortage in China causes the clinic to gather all used masks and try to clean it with water, and they try to resell it again. Is this information accurate?
No. This one I never heard before.
Is it true that the one who got infected must also wear a mask although they were already inside the quarantine zone?
They should.
Can you speculate on how the virus is going to last? How long the virus will last?
Maybe it will last about 3 or 4 months until they find the antidote for this one.
What other knowledge that you feel like the people have to know about and find it very useful?
Strengthen the immune system and take care of good hygiene.
When SARS occurred in 2003, does Malaysia also happen to have a mask shortage at that time?
I'm not sure because I'm still small at that time.
How many masks are left in general, and when will the next batch arrive?
0 currently. Probably next week, I think.
The situation may be temporary because the whole world is doing their part to manufacture mask productions, from converting diaper production lines to mask production, as it is a crucial part to ward off viruses from spreading. The occurrence has also established cooperation among countries. Face masks were shipped off to China and Singapore with awareness regarding to China's situation. Perhaps with the acknowledgement of this issue, the next generation could take the necessary precaution and be prepared for the worst in case this issue happens in the future.